Hey guys, welcome back to the Medicare Masterclass. This lesson, lesson 4, we are going to dive into Part D prescription drug coverage, which is Medicare's regulated program to cover prescription drugs. So, just talking about it and diving right into it, basically Part D is always administered through a private insurance company. Original Medicare does not cover prescriptions. You can only get it either as a standalone prescription drug plan or embedded with a Medicare Advantage plan. That is the only way to get drug coverage that at least is Medicare regulated. So CMS, or the Centers for Medicare and Medicaid Services, they require a plan sponsor, or basically an insurance company, that wants to participate in Part D to cover a certain number of prescriptions in every therapeutic category. But they don't have to cover everything. This means that every plan will at least have something to treat your condition, but it will not cover everything, so it may not treat your prescription, or it may not cover your prescription. So every plan is created different, and no plan's drug coverage is the same. So it's important to take great care when you're comparing plans, and please reach out to us if you have questions as well. So moving on to the stages of Medicare drug coverage. Anytime you're using Part D coverage, either as a standalone plan or in the Advantage plan, this is how your prescriptions are covered. First stage is the annual deductible. Now, this deductible is different with every plan. It may apply to certain tiers of prescriptions. It may not have a deductible at all, or it may apply to all of the tiers. It just depends. But either way, once you reach that deductible, which is basically you're paying the full cost of the prescriptions up to a certain limit, which is set by the plan, then your insurance kicks in and you move to the initial coverage stage. This is where you pay the copays that the plan is assigned for your prescriptions. $2, $8, $45, whatever it is. And you stay in this stage until your total drug costs reach a yearly limit that is set by Medicare. Now, this is where it gets confusing. That yearly limit can be anywhere between $4,000 to $5,000. Again, it can change like any other Medicare costs. It can change year to year, and it may even go higher than that in the future. But general sense, that's where it lies. And you may say, I'm taking $2 prescriptions. How am I ever going to hit a $45 to $100 limit? And, it makes sense. But what they're looking at is the total retail cost of your prescriptions, what you and the insurance company are paying together. So, for example, people with diabetes traditionally have been hit kind of hard in this area because their insulin might be a $30 to $45 copay for them. Off the shelf, it might be $900. So that $900, along with the full cost of every other prescription they're taking, every time you fill it, go towards that set yearly limit of $4,000 to $5,000 or so. Now, if or when you hit that limit, you move to the coverage gap, which is more commonly known as the donut hole. It's not as sweet and sprinkly as we'd think a donut would be, but it's not as bad as it used to be. When I first started this business and getting into it, this used to be really, really bad. You were paying about 51% for generic prescriptions and 44% for brand prescriptions. Now it's come down to a maximum of 25% for all prescriptions, and that's the most you'll pay in the donut hole. Basically what happens, your insurance company kind of takes a bit of a backseat and says, time to start pulling your weight for all these expensive prescriptions we're paying for. And you have that higher cost sharing of 25%. It can hurt, especially with more expensive prescriptions. But again, it's not as bad as it used to be. You stay in this stage until your total out-of-pocket costs reach a set yearly limit, which is different from the one in the initial coverage stage. But what this does account for is everything you've paid out of your pocket. So your deductible, your copays, your 25% here, and also there is a discount applied from the drug manufacturers, that about 70% or so, that's going towards this limit as well. So it's not as bad as it looks, but it can still hurt if you're not planning for it. And just choosing any old plan could be the means of being put in the donut hole or not at all. Besides the fact that you could be paying hundreds of dollars of difference a month or a year just being on the wrong plan. So if or when you hit that total out-of-pocket cost limit, not everybody does, and not everybody hits the donut hole either, but if you happen to be one of those lucky people, you move to the catastrophic coverage, which is the final stage of the drug coverage. What happens here is basically you receive mercy and you pay a small copay or co-insurance for your prescriptions for the rest of the year. And it starts all over again in January in the next year. So that's the stages of drug coverage. If you have any questions, please reach out to us. Like I said, it took me quite a few tries of someone teaching me this to understand it. We want to make sure you understand it as well. So last but not least is some drug coverage terms, things you may come across when dealing with prescription drug coverage. First is the pharmacy network. So like most Advantage plan, well, like pretty much every Advantage plan, they have a network of providers, hospitals, specialists, doctors. Same thing applies to the drug coverage. They have networks of pharmacies and places you can get your prescriptions. It's usually reflected as preferred and standard pharmacies, kind of like in-network, out-of-network. You're going to get your best cost sharing at preferred pharmacies with your plan. So make sure you check with your plan to see what pharmacies are preferred for you. The next terminology or term is the formulary. This is the list of drugs that the plan has opted to cover. And again, they don't have to cover everything. Every formulary is different with companies. They have to cover prescriptions in every therapeutic category, but they don't have to cover everything. And within that formulary, they rank prescriptions in a tier system. Typically, and more often than not, you're going to see just tiers 1 through 5. Some plans use a tier 6, which is basically a subcategory of tier 1. It's a maintenance drug. So if you see tier 6 on your paperwork, don't freak out. That's a good thing. It's one of the cheapest prescriptions you can get. So tiers 1, 2, and 6 are your cheap generics drugs. Tiers 3, 4, you're starting to get your more expensive brand drugs. And tier 5 is your, knock on wood, you hope you never get prescribed, super expensive prescriptions. And every plan will rank these differently as well. In the years I've been in part of this business, I have literally seen a tier 4 drug on one plan be a tier 1 on another. It's just how the companies have decided to contract with the manufacturers and what priority they place on certain prescriptions over others. So don't just pick any plan because your neighbor says it's good. Please talk to someone who knows how to narrow things down and really find something that's tailored to you. So the next thing is step therapy. So your plan may put some certain restrictions on prescriptions as a means to save you money and be a protection to you, because prescriptions can be dangerous if not used correctly. Go figure. The first one is step therapy. What this is saying is basically, let's say you're taking an expensive prescription like Humira. And good rule of thumb, if you see it on TV, it's expensive. Humira can be about a $3,000 to $4,000 prescription off the shelf. So let's say you're taking Humira and the plan may say, ooh, that's an expensive brand name prescription. Can you try taking these cheaper generics first just to see if they work for you? Because if they do, great. You save money, we save money, we're both happy. If not, not a problem. More than happy to cover the expensive Humira for you. We just thought we'd try to save you some money. And that's essentially what step therapy is. So it's pretty simple. Usually applies to the more expensive brand name prescriptions. The next is quantity limits. This applies especially for prescriptions that are a controlled substance, like opioid painkillers. Basically, it's a restriction of how much they will fill in a month's time. They may say, we're only going to fill 30 tablets per month, and we won't fill anything above that. And again, it's a means to protect you. They don't want to get you addicted or be the means of getting you addicted to prescriptions. That's not a good thing. Next is prior authorization. Similar to quantity limits, it's a protection measure. They want to reach out to your doctor to first and foremost see if they actually prescribed it and that it's going to be taken for the right reasons. Now, with all of these limitations, you do have the right to appeal for an exception. And you'll work with your doctor with this, and your doctor will submit the exception to the plan. So if your prescription's not on the formulary, or it's a higher tier level, or it has quantity limits and your doctor's prescribed more above that limit, you can work with them to appeal for an exception with the plan. It can take a few tries. It's not uncommon, but the plan will respond to you within 72 hours, and you'll have an answer. And it's not a difficult thing. So it's very common to have exceptions made for your prescriptions. So those are the terminology, and that also concludes lesson 4. So in the next lesson, we're going to talk about special enrollment periods. So you may be familiar that plans, you have to have a special time to make a change. You can't just change any time of year. So we're going to talk more about those circumstances and periods where you can make changes to your plan. Thanks for watching. We'll see you in the next video.